talk about sandwich technique in this video. What do we see is composite does not adequately bond to the dentine during polymerization. Composite does not and due to this what you'll observe is there could be a gap if the cavity margin is situated in dentine. To overcome this, what we do is sandwich technique. So the bond can be improved by placing GIC, glass ionomer cement, between the composite resin and dentine. Now the GIC bond with dentine is of chemical adhesion, whereas the resin bond to GIC is mechanical. Now GIC can be etched using 37% of phosphoric acid, plus it provides anti-cariogenic effect, that is, it will decrease the recurrent caries amount, effect, fluoride release. Now what are the indications? Where would you use it? First of all, you'll use it in lesions where one or more margin is in dentine, that is the cervical lesions. Then in class 2 composite restoration. Coming on to the procedure, how do you do sandwich technique? So what is done is the dentine is conditioned a thin layer of GIC is applied. It is to be seen that the cement is exposed at the margins to achieve fluoride release. Now the H3PO4 is used to etch enamel portion. We can also etch GIC. GIC can also be etched. Then the surface is washed for 25 to 30 seconds. Then it is adequately dried. The bonding agent is applied to the cement surface. And etched enamel. Then composite resin is inserted. Now what is the type of sandwich technique that we are doing is important to understand. There are two types of sandwich techniques. One is a closed sandwich technique and one is an open sandwich technique. What do you see in closed sandwich technique is that the GIC is placed on the pulpal floor and axial wall, and then composite resin is placed and cured above it. But in open sandwich, what you see is that the GIC is placed on gingival seat and composite is cured till occlusal level. Now if I have to show these rows with a diagram, how will I show it? Suppose this is my pulp, this is my tooth. What do I see is, suppose our cavity is this much. What you will see is enclosed the axial wall and the pulpal floor. This will have GIC. The rest of it will have composite, which will be cured above it. What do you see in open sandwich technique? In open sandwich technique, suppose this is my pulp, this is my tooth. Now what you'll see is you'll have certain amount of composite and you'll have GIC just on the gingival seat. Now what are the advantages and the disadvantages of the sandwich technique? The advantage is that it shows a favorable pulpal response due to biocompatibility of GIC. GIC is a very biocompatible cement. Second is the fluoride release by GIC decreases recurrent caries. Less of composite, so the polymerization shrinkage will decrease. Now coming on to the disadvantage. The disadvantage is that it is very time consuming. It is very technique sensitive procedure. Then the adhesion of composite with GIC is quite objectionable.